We welcome our viewers around the world in this documentary titled Polio's Past, Present, and Future. While the fight isn't over, we inform our viewers on the status of the global fight against polio.
The learning objectives are on your screen. Polio, a disease with roots in ancient times, continues to challenge global health despite significant progress. Its three distinct types spread through contaminated water or close contact. Groundbreaking research, recognized with Nobel Prizes, enabled the development of vaccines by pioneers like Salk and Sabin, transforming the fight against the disease. The Global Polio Eradication Initiative, GPEI, has played a critical role in reducing cases worldwide. While eradication seems within reach, vaccine hesitancy remains a barrier. Renewed global efforts are essential to eliminate polio once and for all. Vaccines, particularly the polio vaccine, have recently been a topic of significant public attention. Notably, much of the discussion appears to be led by individuals outside the medical profession. Robert F. Kennedy Jr., who President-elect Donald Trump is reportedly considering for a cabinet position as Secretary of Health and Human Services, has allegedly petitioned the U.S. Food and Drug Administration, through his personal attorney, to revoke approval of the polio vaccine. According to the New York Times, the petition from his lawyer states, "Petitioner requests that the FDA withdraw or suspend the approval for iPol for infants, toddlers, and children until a properly controlled and adequately powered double-blind trial of sufficient duration is conducted to assess the safety of this product," referring to the standalone polio vaccine used in the United States. The FDA has not yet taken action on the petition, and it's unclear what impact granting it would have on the availability of the other vaccines that protect against polio. In an email to ABC News, a representative for Siri stated that even if the petition is granted by the FDA, adults and children in the United States can still receive polio vaccines because the petition concerned only the license of one of 6 polio-containing vaccines and only as to its licensure for children. In posts on X after the publication of the New York Times article, Siri, RFK's personal attorney, reiterated his belief that the FDA ignored safety concerns with the vaccine. It's an allegation strongly refuted by medical experts who say the benefits of the vaccine far outweigh the risks when considering a disease that can cause paralysis. In this video documentary, we deliver critical clinical and medical insights to our viewers, offering a comprehensive perspective on polio from experienced healthcare professionals. We explore the significant progress made in combating polio through vaccination, the barriers that remain, and the urgent need to sustain global efforts to eradicate this deadly virus. This documentary aims to inform, inspire, and reaffirm the importance of vaccination as a critical tool in protecting lives and preventing the resurgence of polio worldwide. What is polio? Polio is the shortened name for poliomyelitis. It is caused by a highly infectious virus that specifically targets the nervous system of the host. The polio virus is typically transmitted via human waste. It can also be transmitted through an infected vehicle such as food or water that has been contaminated by the virus. Humans are the only known reservoir of the polio virus. Children that are 5 years old or younger bear the overwhelming majority of the cases. The disability that polio causes has been described since ancient times. This 14th century BC portrait of Roma, an Egyptian doorkeeper, may be the earliest depiction of a victim of poliomyelitis. The deformity in his right leg, the use of a cane to walk and support the body are observations seen in more recent time in individuals with polio infection resulting in paralysis. One wild poliovirus, poliovirus 1, still exists in the general population. The other two wild poliovirus types, poliovirus 2 and 3, were declared eradicated by the World Health Organization in 2015 and 2019 respectively. According to the Global Polio Eradication Initiative, a permanent end to wild polio is within reach. As of the 3rd of December 2024, 81 cases, 56 in Pakistan and 25 in Afghanistan, of wild poliovirus type 1 have been reported in 2024. In 2023, Pakistan and Afghanistan reported 12 total cases of wild poliovirus. Many infectious diseases are caused by viruses, which are tiny biological particles lacking their own metabolism and unable to reproduce without infecting a living cell. For a long time, scientists believed that viruses could not be cultured in a laboratory. However, in 1941, John Enders, Thomas Weller and Frederick Robbins successfully cultured the poliovirus in human muscle and tissue. This breakthrough was a crucial step toward developing a polio vaccine. For their work, they were awarded the Nobel Prize in Physiology or Medicine in 1954. The first effective polio vaccine was developed by Jonas Salk of the United States at the University of Pittsburgh in 1952. The team that worked with him included Julius Jungner, Byron Bennett, L. James Lewis, and Lorraine Friedman. A mass immunization campaign, promoted by the March of Dimes, was launched in the United States to reduce the incidence of polio. The Salk vaccine was very effective in reducing the number of cases of polio following a mass vaccination campaign. A reduction in the number of cases of polio was reported, falling from 35,000 in 1953 to 5,600 by 1957. 4 years later, in 1961, the number of cases of polio had been drastically reduced to 161 in the United States. On your screen is Dr. Salk Sabin, who developed the live oral vaccine against poliovirus. It was easy to administer and quickly became the vaccine of choice globally for most national immunization programs. A graph of reported paralytic polio cases and deaths in the United States between 1910 and 1950 is projected on your screen. This was a period when vaccination had not been developed against poliovirus. In 1950, there were 33,300 cases and 1,904 deaths due to poliovirus. By 2019 in the United States, there were no reported cases or deaths from poliovirus, demonstrating the efficacy of the poliovirus vaccine against the disease. On your screen is a share of population of 1-year-olds vaccinated against poliovirus in the year 2000 in select countries. In the United States, it was 90%. Ghana and South Africa had 88% and 71% respectively. India had 57%. Nigeria had the lowest vaccination rate with 31%. By the year 2021, in select countries, the share of 1-year-olds vaccinated against polio had increased. Ghana and the United States at 98% and 92% respectively. South Africa and India with 86% and 85% respectively. Nigeria with 53%, up from 31% reported in the year 2000. So who are those at risk of contracting polio? These are individuals who have not received a full course of polio vaccine. Due to an increase globally in travel, visitors to areas where the poliovirus is in wide circulation in the population are also at increased risk of contracting polio. We recommend you speak with your healthcare personnel when travel to areas with high incidence of polio in the population or areas where vaccination rates for the disease is low. What are the symptoms of poliovirus infection? A majority of people with poliovirus, approximately 70%, have no symptoms. Around a quarter of people experience flu-like symptoms for 2 to 5 days, including fever, headache, sore throat, nausea, vomiting, stomach pain, and fatigue. In 1% to 5% of cases, the virus infects the brain or spinal cord covering, meningitis. About 1 in 200 people develop muscle weakness or paralysis, usually 1 to 3 weeks after infection. This can affect muscles used for moving limbs, breathing, swallowing, or speaking. How is a diagnosis of poliovirus infection made? Patients with symptoms of polio should provide stool samples for viral culture. If the virus is isolated, genetic testing can identify the poliovirus type and trace its geographic origin. Anyone with potential polio symptoms should seek medical attention promptly. While there is no specific treatment or cure for paralysis caused by poliovirus, physical and occupational therapy can aid recovery and improve quality of life. How can the disease be prevented? Polio vaccination is safe and highly effective. In the United States, the Centers for Disease Control and Prevention, CDC, recommends 4 doses of inactivated polio vaccine for children at 2 months, 4 months, 6 to 18 months, and 4 to 6 years. Unvaccinated individuals should get vaccinated, and those vaccinated in childhood should receive a booster before travelling to areas with circulating poliovirus. We recommend you speak with your healthcare personnel for additional information that may be pertinent to your location. Since 1988, a global campaign to eradicate polio has been underway, led by the Global Polio Eradication Initiative, GPEI. This initiative was launched by the World Health Organization with the ambitious goal of eradicating the disease worldwide by the year 2000. At the time, polio was endemic in 125 countries, making the 12-year timeline a formidable challenge. Despite the enormity of the task, the campaign marked a pivotal moment in global health, bringing together resources and expertise to combat one of humanity's most crippling diseases. According to the Global Polio Eradication Initiative website, the initiative was established as a public-private partnership. Today, it brings together several key organizations, including the World Health Organization, UNICEF, the U.S. Centers for Disease Control and Prevention, CDC, Rotary International, the Bill and Melinda Gates Foundation, and Gavi the Vaccine Alliance. Funding for the eradication of polio through the years has been through domestic sources, multilateral sector, non-G7 OECD countries, other donor countries, G7 countries and European Commission, and private sector and non-governmental donors. Beginning in 2009, the share of private sector and non-governmental donors has been steadily increasing as depicted in the graph on your screen. Significant progress has been made toward the global eradication of polio, as depicted on your screen thanks to the tireless efforts of the Global Polio Eradication Initiative. We extend our gratitude to this organization for their unwavering commitment to combating this devastating disease. We also commend the doctors, nurses, and healthcare workers who have played a vital role in eliminating the polio virus from nearly every corner of the world. Your dedication and hard work are deeply appreciated. Thank you. Vaccination has been an effective strategy to reduce poliovirus infection. Recently, the Global Polio Eradication Initiative estimated the number of cases of paralytic polio that were averted as a result of vaccination. It projected that 2.2 million cases of paralytic polio were averted between 1988 and 2018, marking a significant impact in the reduction of the morbidity and mortality associated with poliovirus. On your screen is a world map of the decade of the last recorded wild paralytic polio cases as of 2023. Endemic cases were reported in Afghanistan and Pakistan, depicted in red colour on the map. Wild poliovirus is the most well-known form of poliovirus, but another form, circulating vaccine-derived poliovirus, can also spread within communities. Although rare, circulating vaccine-derived polioviruses have been increasing in recent years due to low immunization rates. The type 2 variety is the most common, with 959 global cases reported in 2020. Since the African region was declared free of wild poliovirus in August 2020, circulating vaccine-derived polioviruses are now the only type of poliovirus affecting the region. So what is next in the fight against polio? Number 1. Boost immunization and vaccination campaigns. Increase coverage in underserved areas and use novel oral polio vaccines to reduce circulating vaccine-derived polioviruses risks. Number 2. Strengthen surveillance and outbreak response. Enhance global monitoring systems to quickly detect and respond to poliovirus in humans and the environment. Number 3. Address vaccine hesitancy and build trust. Combat misinformation through education and partnerships with doctors, nurses, healthcare providers, and local leaders. Number 4. Maintain global collaboration and resources. Ensure funding and coordination among organizations like World Health Organization, UNICEF, and Global Polio Eradication Initiative to sustain eradication efforts. Number 5. Improve public health infrastructure. Focus on sanitation, hygiene, and healthcare systems to prevent transmission and support long-term eradication goals. In summary, now is not the time to question or challenge the FDA regarding the polio vaccine. Decades of scientific research and public health efforts have shown that vaccination is our most effective tool in defeating this deadly disease. Polio once paralyzed and killed thousands, but thanks to vaccines, it is on the brink of eradication. Pausing efforts or spreading doubt risks undoing years of progress and putting millions at risk. Instead of division, we must unite, trust science, and work together to ensure every community is protected. The fight against polio isn't over, and collaboration is key to winning. We recommend our viewers visit the website of the Global Polio Eradication Initiative, polioeradication.org, the website of the US CDC, World Health Organization, and UNICEF for additional information beyond the scope of this video documentary. The learning objectives have been met. Thank you for watching.
If you enjoyed this video, don't forget to like, share, and subscribe. This has been a presentation of Apomulero Media LLC. By subscribing, you ensure you don't miss out on our future videos that delve into fascinating topics from around the world.